Good afternoon, Senator. I hope you're having a great day. If you please indulge me and let me take a moment of your time. My name is Janet Mueller. I'm a registered nurse in a hospital in the city of Houston. On an average day basis, my hospital has about 200 to 300 patients per day. We have the second highest volume in emergency room visits in the city as well, so we're a very busy facility. An increasing amount of our emergency room volume consists of patients with behavioral health diagnoses. This presents major concerns for healthcare. Because of the lack of behavioral health beds for indigent mental health patients, a cascading effect is happening. The patients remain in the ER. They're blocking critical access to acute care patients. It's a barrier to treatment. Our emergency room nurses have turned into behavioral health nurses. They really do not have the skill set, and there's really not enough nurses out there with that skill set. These patients require an elevated level of supervision and care. They're draining resources that are already taxed in the nursing pool. Our facility in the last 2 years has had to hire a staff of behavioral health techs to provide the level of supervision needed for these patients. It was a necessity to provide the higher level of safety for both the patient and the protection of our staff from workplace violence. These added resources come at higher cost to the hospital. I encourage the legislature to explore ways to increase the availability of mental health services, including more inpatient beds. On a daily basis, we can have 4 to 14 behavioral health patients taking up our acute care emergency room beds. We need creative alternatives providing mental health services. We currently have one psychiatrist on staff, and he rarely provides the level of service that we need for all the patients that we have. Alternatives such as telecommunications, telenursing, telepsychiatry, anything to that matter would really help in situations like this. So I encourage you, please support any legislation that can increase mental health services to our community. We'd be grateful. Thank you so much for your time, and I'll let you get back to your day. Bye-bye.